Arterial blood gases. Yeah, ABGs. They can feel super complicated, right? But stick with me, because I'm going to show you a super simple step-by-step way to nail any ABG question the NCLEX decides to throw your way. I promise, it's not as scary as it looks. So here's the game plan. First, we'll lock down the normal values. Then I'll give you a foolproof 3-step method. After that, we'll dive into the 4 big disorders, figure out what compensation really means, and wrap up with some classic NCLEX tips and tricks. Sound good? Let's do it. Okay, first things first, and I can't stress this enough, you have got to know your normals. Seriously, if you don't know what's normal, there's just no way you can spot what's wrong. This is the foundation for everything else we're about to cover.
All right, meet your new best friends. You're going to want to get real familiar with these numbers. So go ahead, take a screenshot, write them on a sticky note, whatever works for you. Just get these locked in. Our pH should be between 7.35 and 7.45. Pass CO2, 35 to 45. Hey, notice how that lines up with the end of the pH range? Kind of cool, right? Then we've got bicarb or HCO3, which is 22 to 26. And finally, PaO2, a healthy 80 to 100. You've got to know these by heart.
Okay, so how do we keep these straight? It's actually pretty simple. Think of it like a seesaw. On one side, you have the lungs, and they control PaCO2. PaCO2 is basically an acid. So if you see a weird PaCO2 value, your brain should immediately scream respiratory. On the other side of the seesaw, we've got the kidneys. They control HCO3, which is our base. So a weird HCO3 value means, you guessed it, metabolic. Lungs control the acid, kidneys control the base. That's the core of it all. Okay, so you've memorized the numbers and you know who the main players are, the lungs and the kidneys. Now for the magic. I'm going to give you a super simple 3-step system that works every single time. Say goodbye to guessing.
Picture this, you're taking the NCLEX. A question pops up with a bunch of lab values, pH, PaCO2, HCO3, and your heart just sinks, right? We've all been there. So how do you look at that mess of numbers and figure out what's going on without totally freaking out?
It's this simple. Just follow these 3 steps in this exact order. Step 1, look at the pH. Is it low? That's acidosis. Is it high? That's alkalosis. That's your primary problem. Step 2, look at the PaCO2. Does it explain the pH problem? Step 3, look at the HCO3. Does it explain the pH problem? By following this order, you cut through all the confusion and go straight to the right answer. So now we're going to connect the dots. We've got the numbers in the system, let's link them to what's actually happening with a patient. This is where it all starts to click and you see the why behind those lab values.
First step, respiratory acidosis. The name tells you everything you need to know. Respiratory means the problem is with the lungs, with CO2. Acidosis means the pH is low, it's acidic. So what's happening? The patient is hypoventilating. Their breathing is slow and shallow. They're not blowing off enough CO2, so that acid gas builds up and pushes the pH down. Simple as that.
And check out the causes. It makes perfect sense. COPD, an opioid overdose, pneumonia. What's the common thread here? All of these things mess with your ability to breathe properly. They make you hypoventilate. So if your patient isn't breathing well, you should immediately be thinking about the risk for respiratory acidosis. Now let's look at the complete opposite, respiratory alkalosis. Again, let the name be your guide. Respiratory, it's a CO2 problem. Alkalosis, the pH is high. So what's the cause? Hyperventilation. The patient is breathing way too fast, like they're panicked, and they're blowing off too much of that acid gas, CO2. Less acid means the body becomes more basic or alkalotic. And again, the causes are exactly what you'd expect. What makes someone breathe really, really fast? A panic attack, right? Or being in a lot of pain, maybe a pulmonary embolism. In all these cases, the person is hyperventilating, getting rid of too much CO2, and that's what sends their pH soaring. All right, let's switch from the lungs to the kidneys. Time to talk metabolic. First, metabolic acidosis. Metabolic means we're looking at our base, HCO3. Acidosis means our pH is low. Now this can happen for 2 main reasons. Either you're building up way too much acid in your system, or you're losing your base. So let's look at the causes. On the gaining acid side, the classic NCLEX example is DKA, diabetic ketoacidosis. The body is just churning out these keto acids. Renal failure is another big one. The kidneys just can't filter out the acid like they're supposed to. Then on the losing base side, the #1 cause to remember is severe diarrhea. You're literally losing bicarb from your, well, bottom end. And our last of the big four, metabolic alkalosis. You guessed it, it's the opposite of what we just talked about. Metabolic means it's an HCO3 issue, and alkalosis means the pH is high, and it's caused by one of two things. You're either losing too much acid or you're gaining too much base.
Okay, for the NCLEX, you absolutely need to know these two, vomiting and NG suction. Why? Think about what's in your stomach, acid. If you're losing all that stomach acid, your body becomes more alkaline. Makes sense, right? Another one is chugging too many antacids. You're literally just adding base to your system.
Okay, here is a golden rule, a pro tip for the NCLEX. You have to lock this in because they love to test this. Vomiting comes from the mouth, you lose acid, you get alkalosis. Diarrhea comes from the other end, you lose base, you get acidosis. Acid from the top, base from the bottom. Got it? Good.
All right, you ready to level up? Because we've got to talk about compensation. See, your body is incredibly smart. When something goes wrong, it doesn't just sit there, it tries to fix the problem. This can seem complicated, but I promise, we're going to break it down so it's super easy to understand. Think of it in 3 stages. First, uncompensated. The pH is messed up and only one other value is abnormal. It's like the body just found out there's a problem and hasn't had time to react yet. Then you have partial compensation. This is where the body is in the middle of a fight. The pH is still abnormal, but now both CO2 and bicarb are out of whack because the other system has jumped in to help. Finally, you have full compensation. This is awesome. It means the body won. The pH is back to normal, but the other 2 values are still abnormal because they're working hard to keep that pH in the right range. Okay, we are in the home stretch. You have the system down. Now, let's do a quick fire round of the most important tips and traps you'll see on the NCLEX. This is your high-yield, gotta-know-it stuff. All right, if you take one thing away from this whole thing, let it be this. R-O-M-E. This little mnemonic is your secret weapon. Here's how ROME works, and it's brilliant. R stands for respiratory opposite. This means if your pH is going one way and your PaCO2 is going the opposite way, you've got a respiratory problem. So if pH is up and PaCO2 is down, that's respiratory alkalosis. See? Opposite. Then ME stands for metabolic equal. If your pH and your HCO3 are going in the same or equal direction, both up or both down, it's a metabolic issue. It's the perfect way to double-check yourself in a flash. Okay, rapid-fire trap alert. When you see COPD, think compensated respiratory acidosis. That's their normal. See a patient having a panic attack, instantly think respiratory alkalosis. DKA, that's metabolic acidosis, every single time. And a patient who got too much morphine, their breathing slows down, so that's respiratory acidosis. Burn these into your brain.
So, let's just take a second. You came here maybe feeling a little shaky about ABGs, but look at you now. You have the normal values memorized, you have a foolproof 3-step system, you know the disorders, you get compensation, and you know the tricks they'll try to pull on the exam. You've got this. So I'll just leave you with this one question. What ABG problem could possibly stand in your way now?